You chose medicine because you wanted to help people. You studied harder than most. You sacrificed more than most. You passed exams that broke others, and yet, some days you feel stuck. Not because you lack knowledge, not because you lack skill, but because of something invisible, something no one taught you in medical school, something called your mindset. Welcome to Mindset in Medicine. Over the next 10 episodes, we are going to explore how your mindset shapes your career, your patience, your leadership, and your life. If you are new here, this is the Medical Hub, a channel dedicated to honest, practical health education for our African communities. Make sure you subscribe right now and hit the notification bell so you do not miss a single episode in this series. Today, we start at the very beginning, the two mindsets every single healthcare worker carries. Let me paint you a picture. Two medical students, same university, same lecture notes, same exams. Student A gets a C in anatomy. She goes home, stares at the ceiling, and thinks, I'm not smart enough for this. Maybe medicine is not for me. She avoids the difficult topics from then on. She does just enough to pass. Student B gets the same C in anatomy. He goes home, stares at the same ceiling, and thinks, I clearly have not understood this well enough. What can I do differently? He finds a study partner. He draws diagrams. He watches surgical videos. He gets an A the next time. Same grade, same situation. Completely different response. That difference is mindset. Now, there are two types of mindsets in this world, and in medicine, both show up powerfully. The first is the fixed mindset. The fixed mindset believes that intelligence, talent, and ability are fixed. You are either born with it or you are not. You are either naturally good at this or you will never be. In medicine, the fixed mindset sounds like this: I am just not a people person, bedside manner is not my thing. I was never good at procedures, some doctors just have the hands, and I do not. Research is for academic types. I am a practical clinician. I cannot change how I work. This is just how I was trained. Do any of those sound familiar? Drop a comment below and tell me honestly, because I promise you, you are not alone. The fixed mindset is sneaky. It dresses up as honesty. It calls itself self-awareness. But what it is actually doing is building a ceiling over your head. And the worst part, you cannot even see the ceiling. You just feel like you have hit your limit. The second mindset is the growth mindset. The growth mindset believes that abilities can be developed, that intelligence is not fixed, that effort, strategy, and learning can transform you. In medicine, the growth mindset sounds like this: I am not good at breaking bad news yet, but I can learn to get better. That procedure was difficult today. I will practice until it is not. I do not understand this guideline fully. Let me research it. My patient did not improve. What can I do differently next time? Notice the word yet. Growth mindset. People use the word yet constantly. I cannot do this yet. I do not understand this yet. I am not confident in this yet. That tiny word changes everything. Now, here is what I need you to understand. This is not about being positive. This is not about pretending everything is fine. This is not about toxic optimism. The growth mindset is brutally honest. It looks at your weaknesses directly. It does not run from difficulty. It runs toward it. Because it believes that difficulty is information. Difficulty tells you where growth is needed. If this is already making you think, go ahead and like this video right now. It tells me this content is reaching the right people, and it helps more healthcare workers find this series. Let us talk about why this matters specifically in our context. Medicine is one of the most demanding fields in human existence. You are dealing with life and death. You are managing uncertainty every single day. You are expected to know everything, perform perfectly, and never crack. That pressure is enormous, and here in Africa, here in Kenya, that pressure is multiplied. You are often under-resourced, overworked, seeing more patients than any one human should see in a day, making decisions without the equipment you need, carrying the weight of families who are counting on you. In that environment, your mindset is not a luxury, it is a survival tool. I want to ask you something, and I want you to answer this honestly in your mind. When something goes wrong at work, a misdiagnosis, a complication, a difficult patient, what is your very first internal reaction? Do you think, I am a bad doctor? Or do you think, what can I learn from this? Do you think, I should never have tried that? Or do you think, how do I improve my approach? Do you think the system is broken and nothing I do matters? Or do you think, what is within my control right now? Your answers reveal your default mindset. And here's the beautiful truth. Mindsets can change. That is the whole point of this series. Let me tell you about a nurse I know. She trained at a public hospital in Kenya, 15 years of service. She watched doctors rotate in and out. She saw new equipment arrive and quickly break down. She saw patients die from things that should not kill people. Over time, her language shifted. It started with small phrases. What is the point? Nobody cares anyway. This is just how it is here. That was the fixed mindset creeping in, not because she was weak, but because the environment wore her down. But then something shifted. A younger nurse joined her ward, full of questions, full of energy, constantly asking why. And instead of being annoyed, this experienced nurse started remembering. She remembered who she was when she started. She remembered why she chose nursing. She started answering the questions, and in answering them, she remembered she still had things to learn. That is the growth mindset reigniting. Healthcare workers, students, this series is your reignition. Each episode, we will take one area of your medical life and look at it through the lens of mindset, how it affects your training, how it affects your patients, how it affects burnout, how it affects your leadership, how it affects your mistakes, and most importantly, how to practically shift it. Because you did not go through all that training to just survive. You went through it to thrive. Before I go, I want to leave you with one reflection for this week. Think about one area of your medical practice that you have quietly given up on improving. Maybe it is a clinical skill. Maybe it is patient communication. Maybe it is your relationship with a difficult colleague. Maybe it is your own well-being. Just identify it, sit with it, and add the word yet. I have not improved at this yet. That is your starting point. Now, I want to hear from you. In the comments below, tell me, which area did you identify? Which part of your practice have you quietly given up on? Your comment might be exactly what another healthcare worker in this community needs to read today. And if this episode spoke to you, please share it with one colleague, one classmate, one friend in healthcare. That one share could change someone's entire trajectory. Subscribe if you have not already, and hit the bell so episode 2 comes straight to you. Because next time we are going somewhere nobody talks about openly. What medical school actually does to your mindset, and why the training system itself can trap brilliant minds in a fixed mindset. This is Mindset in Medicine series, and I will see you in episode 2.